Hi, we're at Spirited Women, Conquering the Middle Ages. We always try to make the refreshments part of the spirit experience, and tonight is no different. So when you think of Conquering the Middle Ages, the theme tonight is kind of a Renaissance feel, as well as foods that help with the Middle Ages. So we're going to start off with our little snack item, which is twigs, nuts, and seeds. It's not trail mix, but really it is. In the Middle Ages, they relied on a lot of nuts and seeds for a big part of their diet. So we thought we would start off the night. Trail mix is a wonderful snack. It doesn't take a whole lot to help make you feel full. Nuts and seeds are good sources of protein. As we approach middle age, we tend to lose our lean body mass. So tonight you're going to see a lot of emphasis on protein to try to help minimize that lean body mass loss. As we move on, we're serving chicken drummies. Again, it's that Renaissance feel. Items that you can eat with your hands, so you haven't seen any utensils yet. Chicken is a nice lean meat. It's low in saturated fats, and it can be part of a healthy diet. Mushroom tartlets are our next item that we're serving today. Mushrooms were a big part of the Renaissance diet. They grew wild. They used mushrooms in soups, stews, in ways that we wouldn't even imagine now. So we thought we would include it in a more modern way as a mushroom tart. Then we're going to move to a cheese and grape tray. Cheese is another good source of protein. The emphasis should be on lean cheeses made from low-fat skim milk. Grapes are a great source of lutein. Lutein is important in one's diet as we get older, more and more so, and one of the things it can do is help prevent age-related eye disease, so like macular degeneration or cataracts. And we're going to end with apple enchilada dessert. Apples were another food that was readily available in the Middle Ages. It's still readily available. So let's include it as a little snack. We did include forks for that. We thought it might get a little messy. Downstairs we are serving apple cider for our beverage of choice tonight. So bon appetit.
So welcome to our event tonight. As you already know, we're doing Conquering the Middle Ages, which is a topic that we run into just about every single day. Somebody is seeing myself or Dr. Kolrud. They have a ton of questions. They don't know what to do. They're miserable. So we're here to hopefully field some of those questions for you. So the question that we see, what is menopause? So menopause is defined as 12 consecutive months without a period. So that is the definition that we go by. Another question we often get is, when does it start? And the answer varies, but the average age is about 51 years. And if you think about that, the average female life expectancy is 86 years. So 1/3 of your life is spent in the postmenopausal state. So this is an important thing for us to talk about and address with everybody. So when does it end? That's the next question. When will it be over with? This is a little tricky part of the question and the answer. So there's the perimenopause phase, and that's before menopause. So before your period stops. And the average age that hits is about 46. And then there's the postmenopausal phase that everybody is very familiar with. And surprisingly, technically menopause only lasts 24 hours, the actual menopause state. I know. So what? Everybody disagrees with me on that. Biologically, that's what they say. So many people say, what can I expect? Well, let's talk about that. There's estrogen receptors everywhere in your body. So as you can imagine, your hormones are changing, so they can affect pretty much everything, for lack of better words. So here is a list of some of the changes that you might remember going through or your experience currently. Menstrual changes, hot flashes or flushes, night sweats, insomnia, anxiety, depression and sadness, mood swings, irritability, rage, vaginal dryness, loss of libido, breast tenderness, fatigue, weight gain and bloating that I get a lot, difficulty with concentration and motivation, achy joints, skin changes, hair loss, headaches, tingling, a buzzing sensation or burning in your tongue, and heart palpitations. These are just a few. You might experience a whole lot more. So what can be done about it, right? That's what everybody asks us. I'm experiencing this and I don't like it. So don't worry, you're not the only one. And yes, there are things that we can do to try to help you get through these symptoms that are disturbing to you or your family members. So the first thing we ask, if there's something that's bothering you, write down a journal and tell us. How often are you having symptoms? What are your symptoms? And how are they affecting your life? That helps us figure out what we can do. There's lifestyle changes that can easily be done to try to help you, and there's also medications. So some of the lifestyle changes, make sure you're taking care of yourself. Most women are busy and they put their families first and they forget to take care of themselves. You're worth it. Make sure you focus on yourself. Make sure you make time for exercise. You want to do weight-bearing exercises, flexibility, strength and balance, as well as cardio. Most people always are like, I'm not a runner. Yep, I get that. There's other things we can do to try to help you. Try relaxation and self-calming techniques. Yoga, breathing exercises, walking, reading, whatever it is that helps you kind of take that time for yourself. You can try to avoid alcohol and spicy foods. And then last but not least, try to maintain a normal body weight through proper diet and activity. Yes, we know that is not an easy thing, and we hear this all the time. So what we need to know, as we age, we still need our vitamins and our nutrients, but generally we don't need as many calories. That's the hard part, especially living in Wisconsin. So participate in those weight-bearing exercises, such as walking or dancing 3 times a week, really do help boost your metabolism and keep it up and running. You can also talk to your friends. There's different groups. There's groups online, chat rooms, different things that you can do. People complain about skin issues, so make sure that you're following up with your dermatologist or treating yourself appropriately for anything that you might have. So those are the lifestyle changes that you can make. It's also important to get into a normal sleep pattern. A lot of people complain about insomnia, so you want to have a sleeping schedule. You want to try to go to bed and wake up the same time every single day. Easier said than done, but that's good sleep hygiene. You want to avoid alcohol and caffeine and eating just before bed. Those are things that don't help you get that good night's rest. And again, same thing. You want to take a break from TVs, cell phones, and any other electronic devices that stimulate your brain to kind of keep functioning instead of settling down. Those are all good things to try to improve your sleep hygiene. Last but not least, I'm going to hand it over to Dr. Kolrud, and she's going to talk about the medications that we can prescribe.
Thank you. Thanks again for all of you coming out tonight. I know Jen was happy to throw this over to me. So we'll move along to, and Nan, thank you for putting this program together. We'll move along to hormone replacement therapy. Some women will be candidates for hormones, and our guidelines are that we use the lowest dose for the shortest duration. And ideally, we're using hormones in women that are recently menopausal, so typically within the first 5 years of menopause. Vaginal estrogen is extremely safe, and that is used for vaginal dryness. So it comes in the form of creams, E-string, which is a ring, and also tablets. And we can talk more about that specifically later if some of you have questions about that. Bioidentical hormones are talked about a lot. Those are compounded by a specialty pharmacy. There's a little bit of confusion out there in terms of women thinking that bioidentical hormones are perhaps safer than our standard hormones that we would prescribe. We don't have any evidence to show that they're safer. For the most part, they do work just as well or may work better for some women. The nice part about bioidentical hormones is that we can tailor it a bit more to fit each patient. So sometimes we're including estrogen, progesterone, testosterone, and DHEA. Other prescription medicines that help with the symptoms of menopause, Effexor, which is an antidepressant, Prozac, antidepressant. Clonidine is used for high blood pressure, but happens to help with hot flashes. Gabapentin is used for seizure disorder and restless leg syndrome. It's not FDA approved for hot flashes, but it does work for hot flashes. Paxil is an anxiety medication that works really well for hot flashes. And then the newest thing on the market really that I'm aware of for vaginal dryness is ospemophene, and that is an oral tablet, but it works specifically on the vaginal mucosa. Beyond those things, we're gonna jump to food. We talked about some of these things in an earlier Spirit of Women, but these are superfoods that Dr. Oz had on one of his lists not too long ago, and they include turmeric, the spice, black soybeans, coconut oil, the chia seeds, dark chocolate, which most of us have already adopted, lingonberries, eggs, and beet juice. I think beets themselves would be just fine. Mustard greens and sweet potatoes. Sweet potatoes actually have a little bit of plant estrogen in them, so that's why that's helpful with hot flashes. So, postmenopausal zest is a term that's been used once or twice, and it was coined by Margaret Mead, an anthropologist, and she said that postmenopausal women were the most powerful force in the world. I think Hillary might agree with us right now. Women over 50 are the new world power brokers. And postmenopausal women are feisty, they're sexy, they're creative, and they're full of power and energy. And menopause should be celebrated as well as respected. The little toast down in the corner, if you can't all see it, it says, "Here's to strong women. May we know them, may we raise them, and may we be them." And lastly, menopause is actually a gift. I looked up menopause under Wikipedia for a previous lecture, and one of the theories is that of the grandmother hypothesis, and it said that menopause, there's an evolutionary rationale for it, and that it occurs in women to promote or maintain the safety and the survival of grandchildren. So I think that could be true. Yeah. So let's see. Lastly, menstruation, menopause, mental breakdowns. Notice how all of women's problems begin with men. So, anybody have any questions? I know we gave you those little sheets if anyone wants to jot down an anonymous question. We can do that. Or maybe everybody knows everything about menopause. I feel like we've been talking about menopause for so many years.
On the front of your folders, you have some sheets, like a little notepad, and if you want to ask a question anonymously, because we're videotaping and you're afraid, we won't. But if you'd like to ask an anonymous question, or just a question and write it down, I will submit it to our two experts. Or you can just raise your hand and ask a question. That would be okay too.
Absolutely.
I know my question for Dr. Kolrud earlier, a couple of weeks ago, was about sleeping. Because my question for Dr. Kolrud that I asked her a couple of weeks ago was about sleeping, because I have stopped sleeping. And I don't know if any of you are experiencing that, but that's pretty common, that you might get to sleep, but you don't stay asleep, or you can't get to sleep. So perhaps you could talk about that, Dr. Kolrud.
Absolutely. You know, I guess I usually ask patients first if if it's a new problem, if it's a menopausal problem, or if they've always had trouble sleeping. If it's a new problem, then my next question would be, are you waking up because of a hot flash? And if it truly is a nighttime hot flash, that's normally remedied pretty easily with oral estrogen. And we would use it, again, the lowest dose for the shortest time frame. Most women need their hormones for an average of 2 years, just to help them get through that transition. But, you know, if they're having trouble beyond that, then sometimes it can be other things. It could be anxiety, and, you know, we would go through all the same things Dr. Kolodziej mentioned earlier about sleep hygiene, turning off all the electronics. I was going to tell you recently about white noise, Nan.
I do white noise.
Okay, you do white noise. Okay, because that helps a lot of people sleep, to have white noise either on your phone or your computer, or I don't know how else people do it, but pets in the room apparently sleep better with white noise too. But sometimes people do need prescription medication. So if estrogen wasn't helpful, then we would look at prescription medication to help you get a good night rest, good night's sleep. And it's probably going to be short term. It's not going to be forever. It's going to be to get you through that transition.
What about melatonin?
A lot of people have good luck with melatonin. It's over the counter. I mean, you can try it. It doesn't work for everybody. It's safe, you know, following the directions on the bottle. Some people swear by it.
How about essential oils?
I've been hearing a lot of women around here lately talking about essential oils. I don't have any personal experience using them for sleep, but I've always liked essential oils in labor and delivery, and, you know, we use lavender and so forth for calming and for pain relief and all that. So any suggestions you have about sleeping and using essential oils, I think that'd be great. I imagine it's the same ones, the lavender and the calming oils, absolutely. And all the products that they have on the market for helping us sleep, you know, the sprays that we put on our pillow and everything, typically have lavender in them.
She gave you some questions.
Oh, excellent. Okay, let's take a look here. Essential oils. Do you have a favorite that you would use for sleep on the essential oils?
Well, the lavender, and there's some other blends that product that I'm using.
Absolutely. Okay, let's see here. You might have to come and answer one of these too, Jenna. How would a person, or when would a person start to taper off oral estrogen? When, as far as when to do it, you know, I wouldn't do it in the middle of summer, I guess. Right, and I wouldn't do it if you were newly menopausal. I mean, the average length of time that you're going to be on hormones is 2 years. So I probably wouldn't do it before that time. There's not a good reason to come off of it. Once you get to 5 years, you should be thinking about coming off of the estrogen. If you've been on your estrogen 10 years, you are at increased risk for breast cancer. So we try to get you weaning off of it once you hit that 5-year mark. And how to do it, there's no magic. I think most people have good luck going every other day first cut the dose down, of course, but then go every other day, every couple days. And it does seem to work well when they do it that way.
Would that be the same for the Vag tab then, that's estrogen?
Well, personally, I don't think there's any reason to stop that vaginal tab that you're using for vaginal dryness, as long as you want to maintain a healthy vagina, especially if you still have a healthy partner. I would keep that going. Yep.
Well, we'll continue with that topic. We have a question that says, when speaking of vaginal dryness, is it common to have tearing or cracking or bleeding during sex on the outside of your vagina? It is. If you do not have the estrogen to keep that tissue moist and healthy and stretchy, elastic, you will have all those symptoms. It can be very painful, it can be very catching. So the vaginal dryness is treated basically with any of the vaginal estrogens, and continuing those until you no longer either want to be sexually active or aren't having those symptoms. That's what I keep all my patients on. I'm sure you do too. And then we also talk about different lubrications using during intercourse. There's a whole wide range of over-the-counter products. And recently I've had a couple patients tell me that there's an article out there for unrefined coconut oil, organic, that seems to be the best for postmenopausal women with intercourse. That is what my patients are bringing to me. I have not yet read or researched on that, but it seems to be very helpful for them.
Right. I have had patients tell me too that they think the best thing is the olive oil for the personal lubricant, which if that works for you, that's great. The only thing the olive oil or the coconut oil don't do is that they don't change the vascular supply to the vagina. So the vagina is still going to be lacking the ability to really stretch. So it's going to look white, basically, versus a vagina that has estrogen there, it looks pink. And it stretches and it's more compliant, and sexual enjoyment is going to be better and all of that. But if you're not a candidate for estrogen at all, then definitely you want to at least have a personal lubricant, or coconut oil or olive oil from the kitchen.
Yeah. Sure, whatever you got.
Natural, are there natural Oh, sure, I can talk about that one. Our next question is, are there natural remedies for hot flashes and night sweats? And there are lots of things available. The things that have been used the most, I would say, are evening primrose oil, progesterone cream, Estrogen. These are all products that you can get over the counter at the grocery store now, or certainly at the pharmacy. The problem is that all the studies that have been done show that these products are no better than taking a sugar pill. But every woman is different, and if a woman says it works for her, great, then just keep it going. But the big studies show that they don't work any better than taking a sugar pill. And the only thing that really works consistently is going to be estrogen. At least, early on in your menopause, that is the best thing for treating hot flashes and vaginal dryness.
I think you touched on that. Is it over the counter?
Oh, Estroven, Estroven. It is. It's over the counter. It is over the counter. And I don't think it ever hurts to try. I mean, you might be one of those people that finds that it's helpful, but you shouldn't get discouraged if you try it and it doesn't work. Then you should go and talk with your healthcare provider about getting, perhaps getting a prescription for short-term use. You don't have to suffer through it. So.
Do you have thoughts on
Oh, I should have known they were going to ask about that. I have to say I am not yet terribly
better ask Helen.
educated.
Yeah, I'm neither am I.
You're on either?
Yeah, so
Okay.
the question is, what are your thoughts about the new Viagra for women? And I agree. I am not well educated, and I've had this question just this week. So I
More to
have
come.
I have more research and readings of different studies to really give a decent feedback on that. So I don't right now have the answer.
I really don't either. I have no experience with the drug.
Yeah, so
Right.
we'll have to get back to you on that one once we learn more ourselves.
We'll get back. Yep. Do we get all of them?
No, there's these two.
Okay. Oh, okay. I can talk about
Okay.
that. The question is, you suggest two years for estrogen support. Is there an average length of time for bioidentical progesterone? Not really. I think, what we know from the studies is that if you don't have a uterus and you need estrogen replacement, your best bet is to just go with estrogen. You don't need to put the progesterone with it. And there's not a really good reason to add it. So for those women, they're usually just getting estrogen replacement. If you still have your uterus intact, we have to give you estrogen plus progesterone. But many people feel that it's actually the progesterone part of the combination that may be more associated with breast cancer. So if you have the option to only take estrogen, that's a safer route for you if your uterus is gone. So how long to use progesterone? People would say the same thing, 10 years. After 10 years, probably shouldn't be on it. Well, not that you can't, it's always a personal choice, but your risk for breast cancer goes up after 10 years. And there are a lot of women who say they're willing to accept that risk. So that's a personal choice.
Our last one.
Last one, you want me to do it, Jen?
Sure, you
It
can.
says, it's been 2 years since my hysterectomy. I still have hot flashes and sex is painful. I have a history of cancers in the family. What do I do? And so I'm thinking this patient probably is not on hormone replacement therapy because she has a family history. What to do? So she would be a good candidate to use other things other than estrogen for her hot flashes, like the Effexor or the Clonidine or the Paxil, the things we talked about. And then locally, for vaginal dryness, she's still a candidate to use local vaginal estrogen. That is a very safe drug, and even women who have had breast cancer and are out at least 5 years, generally their oncologist will, especially if they're having a lot of painful intercourse, they're usually okay to use it in small doses. So it's a local absorption. It's not, right, it's not systemic. It's just going to affect the vagina. So, okay. We keep coming back to the vagina.
Yeah, seems to be our specialty.
Right. All right.
Yes, ma'am?
Dr. Kolodziej, could you talk just a little bit about incontinence? Because this is a time when women also start to experience, after childbirth, they sneeze, they laugh. Perhaps you could talk a little bit about what kind of treatments are available.
You want me to do it?
Sure.
I probably see a lot more patients with incontinence than Jenna. Incontinence, yes. So one of the first things, again, we would look at vaginal health. And so if the vagina is atrophic, sometimes just getting the estrogen going there again in the vagina will help the bladder function. The bladder sits right on top of the vagina. So that's one thing. But we would go back to the diary business. If you're having incontinence, keep a diary. When does it happen? How often? Do you have to wear a pad? Is it with exercise? Is it not with exercise? Is it happening during intercourse? Is it associated with urgency, frequency? Write all those things down and how often it's happening, and then bring it into your healthcare provider and talk things over. Sometimes we would take it to the next step and do a bladder study called urodynamic testing to see how your bladder functions when we fill it up with fluid. It's a painless procedure in the office, doesn't take very long to do, and it gives us really good information so that we can figure out how to get the patient dry, how to get you dry. And sometimes it's medication, sometimes physical therapy, or a combination, and sometimes it's surgery.
Can you record how much you're drinking and what?
Yes, she mentioned record what you're drinking and the amount and what, right? In the diary.
Physical therapy?
Pelvic floor. So it's pelvic floor therapy, basically, where they work on strengthening different muscles in the vagina to target whatever your symptoms are, if it's stress incontinence, urge incontinence, just to try to build it up. So it is a slightly different than what everyone's used to, Kegels. That people are like, oh, I'm doing my Kegels. Well, there's other exercise, and there are therapists that specialize just in pelvic floor therapy that can help.
The physical therapy group here at Aspirus Riverview, several of the ladies kind of specialize on pelvic floor strengthening, but I'm sure all of the physical therapy groups in the area would offer that treatment. I think I don't see any other hands. Okay.
Well, there's got to be other questions.
Oh, there's got to be other questions, Nan says.
If one wants to be assessed for levels against hot flashes or whatever, can a blood test or can you do a test that help assess what's going on?
You can. You absolutely can. It's not actually recommended that we test every woman for menopause. So we don't necessarily need to do that. We would go over, your clinical situation, and it's usually pretty obvious what's going on. But we do use the lab values when we're tailoring or customizing the doses on the medication. You bet. Yep.
Doctors, when should a woman decide that it's time to see a provider if she's experiencing pre-menopausal symptoms? When is it time to say, you know what, maybe I need help? Because I think that a lot of women suffer in silence.
I would say that it's time to see us if it's interfering with your lifestyle. If you're not sleeping or you aren't doing things that you normally would do, then it's definitely time. I mean, we have options out there to treat almost a wide range of symptoms. We can customize everybody's treatment to specifically target what is bothering you the most. And we don't always have to use hormones. I know a lot of people get nervous about that. We can try different things, and I'm sure Dr. Kolrud agrees with me. I work with my patients very closely and try to make them happy, as well as try to decrease any symptoms that they don't like that they're experiencing.
I've had hot flashes for at least 15 years. Do they ever go away? I mean, really, I take Effexor and it helps, but can I ever get off of it? And do they ever go away?
There are a few out there like you.
Yes.
Right. I'm sorry.
Yeah.
They might not ever go away. I mean, usually our 80-year-old ladies are not saying that. usually. But I've had lots of women all through their 60s say they're still having hot flashes.
Yeah.
Right. So.
Yeah, I agree.
Stay on the Effexor. Right.
How long is it safe to stay on, like, the Effexor?
That one's fine.
That one would be, yes, is fine.
Oh,
right.
repeat it?
Oh, yes. She asked, how long is it safe to stay on Effexor for hot flashes? And there's no time limit with that, as long as you're tolerating it well. And yeah.
I did have a question back here about hair thinning. Is that common during menopause or pre-menopause?
You know, I don't know if you want to say anything, Jenna. What I know about, hair thinning in menopause is that initially we see some hair loss, and it's from the abrupt change in our estrogen level. So similar to, pregnancy changes, and then it stabilizes. And what we see after that is really more aging. It's never going to go back to how we were when we were 30. Probably.
I agree.
You agree?
Yeah.
Right. But it does stabilize. I think most women find that it stabilizes a little bit. Estrogen is not some magic pill for making your hair come back. I will tell you that. It doesn't do that. Right.
Question back.
I just was wondering, like, if a woman's on anxiety medication because of having a husband.
We're back to men again.
Yeah.
Anxiety medications, I mean, do you see women in their 70s, 60s, and 60s still having to be on stuff like that?
My mother-in-law. Yes.
A select few, yeah.
Yeah.
Unsafe to be on them that long?
She's asking, is it okay to be on the anxiety medication, and can you be on it long term? And usually your primary care doctor probably is writing that medication, and you're getting yearly labs, and as long as you're tolerating it okay, you can stay on it. And yes, some people are on it forever. Generalized anxiety doesn't necessarily go away as people get older. It can get worse.
Yeah,
Right. Yeah.
Yes?
Does menopause affect your cholesterol level? Because mine has really gone up with no other changes in my lifestyle other than being in menopause. I mean, I have the same amount of exercise, everything, but my cholesterol has gone up like 50 points.
I don't see that.
Yeah, I was going to say, I think probably there is a correlation with it, but also it's age, that is when people are going to see that their cholesterol may start rising, even when we've never had a problem when we were younger, but now as we're getting older, we see that starts to go up. So it's probably more related to that. It's not something I usually think of when someone first goes into menopause. I don't immediately check her cholesterol level, right?
Yeah.
It's age related. All right. I think that's it, huh? Thank you all so much for coming.
Thank you.
Yeah, we appreciate it.